Hello, please subscribe and like for our channel. Thanks very much.
Hello, now in this case you have a 10-year-old boy and they are asking you to list 3 abnormalities. So you see the abnormality, you first see at the level of the face. Is it clear? You have a puffy face. Is it clear? The second abnormality you see at the level of the abdomen, you have a swollen abdomen. That abnormality you have what? Pedal edema. And the pedal edema is highly grade. You see even the pedal edema though goes up to the thigh. Is it clear? It can even go up to grade 4, though we grade the pedal abnormality and pedal edema by the timing of their rebound. Is it clear? So those are the different things that you have to know. So those are the 3 abnormalities: puffy face, swollen abdomen, and you have or distended abdomen, and we have pedal edema. Now the next thing is B. What is the most likely diagnosis? Every time you have to know that what the diagnosis, there are 3 major diagnoses which are associated with fluid accumulation in the body. That's pedal edema. 3 major diagnoses when you have pedal edema. Is it clear? You first think of heart failure, you think of liver cirrhosis, liver failure, and you think of kidney failure. Is it clear? Every time that you have a patient that has pedal edema, you think of 3 organs: the heart, the liver, and the kidney. Is it clear? But now, when the edema involves the whole body, meaning that it is called anasarca. So if they ask you the general term that characterizes all what you have seen, puffy face, abdominal distension, and pedal edema, when you have an edema all through the body, it is now called anasarca. And every time you see anasarca, the first organ you first call is who? You call first the kidney. The second organ that you call in anasarca is the liver, and the third organ you call is the heart. Is it clear? But now, when you just see pedal edema, the first organ you call is the heart, the second organ you call is the liver, and then the third organ you call is the kidney. Is it clear? That's the order you see. So if you see a patient that has a puffy face, is it clear? If you see a patient that has a puffy face before seeing distended legs, if you see a patient that has a puffy face before seeing pedal edema, it means that it is first the kidney that is involved. The liver is in the middle. But if it's instead the liver that is the pedal edema, and then you have no puffy face, you first see the heart abnormality. That's how you have to visualize medicine. Is it clear? Now, in this case, when there is all this anasarca, you think of the kidney, and the major abnormality inside the kidney is a protein losing pathology, because the proteins are the one that maintain the oncotic pressure. So the kidney abnormality here is not just a kidney failure, but it is a protein losing abnormality of the kidney, because in order to maintain the hydrostatic flow of the body, is it clear, the proteins, which is particularly albumin, is required to maintain the oncotic pressure of blood, and if it is lost via the kidney, it's going to cause this anasarca. So now, which pathology causes a high loss of protein from the kidney? It is called nephrotic syndrome. Is it clear? So nephrotic syndrome is the most common diagnosis. And now there are 5 major abnormalities of nephrotic syndrome. There are 5 major elements inside nephrotic syndrome. The first element inside nephrotic syndrome is that you are going to have what? You have edema. Is it clear? Pedal edema or general edema of the body. Second element, you have hypoalbuminemia. Is it clear? Second element, you have hypoalbuminemia. Third element is proteinuria. The third element is proteinuria. But you can even start with proteinuria before saying hypoalbuminemia, before saying edema. Is it clear? Now, after having those 3 major elements, you have now the minor elements. There are 2 minor elements, which is hypercholesterolemia or hypertriglyceridemia, meaning that what? The body is going to produce excesses of the cholesterol because of loss of protein in order to compensate that loss of protein in blood. Is it clear? And then the 5th element is what? Is renal failure. Is it clear? So those are the different elements that made up of making up the nephrotic syndrome. Now, the next question is list 3 important biochemical abnormalities found in this condition. Is it clear? They said biochemical abnormality. The first biochemical abnormality that I've already said, I've said hypercholesterolemia, hypertriglyceridemia. That's one abnormality, hypercholesterolemia. The second abnormality, biochemical. We said what? We have hypoalbuminemia. It's a biochemical abnormality, not so. So you have hypoalbuminemia. Is it clear? Now you have also proteinuria. Is it clear? As I've said initially, is it clear? And we have also renal failure as a fit with the fourth biochemical abnormality. So now the next question is, and what are the characteristics of renal failure? Renal failure is characterized by a reduced renal filtration. And how do you calculate renal filtration? By using what? By using either the MDRD formula or by using the Galt's formula. Is it clear? Now, by using those two formulas, the major parameter is either the creatinine or urea. So, urea and creatinine are the major parameter that per clinical investigation that helps you to know the clearance of the kidney. Is it clear? So, that is the abnormality that you have to check. So, the next question now is,